Spring weather and spring sports are right around the corner, which means the chances of injuries are too. The team at Illinois Bone and Joint Institute says not only can they help fix the injury, they can help strengthen the athlete to prevent problems in the future.
Baseball injuries can be broken down into sort of traumatic injuries and also chronic overuse injuries. If you're doing the same activity over and over again, you could get arm injuries such as shoulder injuries, and then everything to more serious things like rotator cuff tears and slap tears are some of the common ones that you hear about. Then you get elbow injuries. There's also traumatic injuries, things like collisions, sliding into a base and injuring your finger. The thing that's a little bit scary out there is a lot of kids are specializing at a very young age. They're playing on multiple teams. Those sort of injuries can accumulate, especially if there's bad mechanics going on with the player. You want to work on your conditioning, so you want to make sure that you have the endurance. So you're strengthening, you're stretching, you're making sure that you're balancing out all those muscles. Also, you're working on your mechanics. A lot of people think of pitching or throwing in general as an arm sort of activity, but actually it's a whole body activity, and most of the force is actually generated from your legs and your core, and the arm is just the final piece of that puzzle. So really, you shouldn't be throwing with your arm, you're really throwing with your legs and your core. These are growing children. They have open growth plates, and sometimes they're throwing faster than their bodies can handle. Children will be throwing so hard that they will actually break pieces of their bone off with a throw. The pitches that are going more straight, so to speak, like a fastball and changeup, don't involve much torque to the arm. But once you start including things like sliders, breaking balls, a lot of these kids are doing it improperly. It goes back to that growing arm. It puts a lot of force not only on the ligament, but on the bone that's attached to the ligament. Certainly you see an uptick in injuries as those breaking balls get introduced, especially if they're doing it improperly. A lot of us have a very basic idea of what we do when we get an injury. You use rest, ice, anti-inflammatories. That's a very simple thing to do without even seeing the doctor first. But once an injury happens, sometimes you do those things and it's still not better. And so I would obviously see a professional, a physician like myself, who specializes in sports injuries, shoulder and elbow injuries, or whatever body part is injured. Here at Illinois Bone and Joint, we actually have OrthoAccess clinics where you can see a doctor the same day. You can walk in just like you would walk into an emergency department or urgent care center. This facility is actually attached to what is called the Health Performance Institute. I see the patient has an injury. Usually I will treat them in whatever way is possible. Usually that involves non-operative treatment for most of my throwing athletes, and then they go to physical therapy. The Health Performance Institute is meant to basically improve patients' performance so that they could get back to their previous level of function and maybe even better. And so they will work with trainers who will do things that we talked about, work on their mechanics, work on their conditioning, work on their legs and their core, not only prevent injuries in the future, but boost their performance. We have players from all fields, from gymnastics and ballet to soccer. And it's not just the athletes. We're talking about adults that want personal training for their own fitness. We have some patients that are elderly that just like to stay in shape. So it runs the whole gamut from young active children and teenagers to people that want to be weekend warriors and just healthy in general.
If you would like more information about Illinois Bone and Joint Institute, head to the website you see right there on the screen.